I first came to know Bishop Dowling in the year 2000. I was teaching in Manila in the Philippines. Bishop Dowling was basically in New York being interviewed by a reporter who wanted to ask him the question, what did he think about HIV/AIDS prevention, and what should be his position as a bishop in the church? And he began to talk about his own experience in South Africa. And in talking about his own experience in South Africa, he began to talk about the experience of people who were in their own poverty, completely marginalized, and they were looking for some sort of assertion and validation of the way they were trying to struggle in a world in which they were completely marginalized. And they asked for greater specificity, being good reporters. And at one point, he was finally confronted with the question, well, what would you have to say about condoms? And he began to give an argument as one of the first bishops from Africa to say that these are part of the solution for HIV/AIDS prevention. I was in Manila at that time, and my colleague John Fuller was here, and we began to send emails to Bishop Dowling to say, can we be of any service to you? And in the past 4 years, we've been in a writing correspondence with one another, mostly not about condoms, but about other issues dealing with HIV/AIDS, such as the importance of recognizing the equality for women, such as recognizing the importance of access to antiretroviral treatments, such as recognizing the vulnerability of children, such as recognizing what poverty does when people are at risk to major health pandemics. And so we've become people acquainted with one another by the internet, but not by the flesh. And so Kevin arrived yesterday at about 12:30 and quickly met my students from my class at 3 o'clock, and then met with the African Jesuits at 8 o'clock, and met with 4 different reporters from NPR, Boston Herald, the Boston Globe, and everywhere else. And you'll see, unfortunately, that every question that the people were asking was about condoms, at least in the news media. So I hope that this evening we'll get onto a variety of other topics that deal with HIV/AIDS and the question of South Africa. Kevin was born in 1944 in Pretoria, South Africa. He's the eldest of 3 children. He was ordained a priest in 1967, and in 1968 he began to minister in the township communities in Cape Town for 5 years, where, as he tells us, he had a conversion experience because he was an active member of the Ecumenical Christian Institute, which monitored and acted against human rights abuses and injustices against the population. He was later elected provincial of the Redemptorists in South Africa and Zimbabwe, a position he served as provincial for 11 years, and we're honored to have one of his brother Redemptorists from the Mission Church, Father Kevin, here with us this evening. After he served 11 years as provincial of South Africa and Zimbabwe, no good deed went unpunished, and he became, therefore, a member of the General Council of the Redemptorists in November 1985, and worked in Rome for 5 years on the leadership council there. And as he finished that term, and as he said he wanted to go on for studies in moral theology, he was made Bishop of Rustenburg, South Africa, a diocese which is about the size of the country of Wales, and which has about 20 priests in it and a variety of religious and lay leaders who help him in his work. He has been there since January 27th, 1991. He's been very involved in the justice and human rights struggles in the BOP homeland in which the diocese is situated from January 1991 until the first democratic elections in South Africa in April 1994. And he has served on the Bishops' Conference Justice and Peace Department for the past 11 years, and at present is the vice chair there. In 1999, he helped set up the National Catholic AIDS Office, which is directed by Sister Alison Monroe of the order of preachers and continues to serve as on its management committee. He was elected in February 2003 as the chairman of the International Sudan Ecumenical Forum, through which he is actively involved in the Sudan peace process on behalf of civil society, the churches, and international NGO groups working together for the cause of peace, justice, and human rights. Finally, he is one of the 6 bishops who are trustees of the Ecumenical Solidarity Peace Trust, which is actively involved in research and analysis of human rights in Zimbabwe and is working with community groups and individuals in advocacy for justice and human rights in that country. So in my gesture of gratitude to Boston College, I present to you a wonderful friend and a man of great leadership in the Catholic Church, Bishop Kevin Dowling.
Thank you very much, Father Jim. Good evening, everyone. It really is an honor and a privilege for me to be with you this evening. I thank you all for coming out this evening to hear what I hope will be of some interest to you and broaden your perspectives on the HIV/AIDS pandemic in sub-Saharan Africa and in South Africa in particular. That introduction of Father Jim, telling you when I was born and so forth, I was born on a very romantic day in February, if you can work that out, which people who've met me and know me say explains a lot about me. But I would like to simply share with you this evening, in a very simple way, the fruit of a journey I have been making for the past maybe 10, 11 years in South Africa, a journey that I'm privileged to share with, in particular, people whom I call the new heroines of our world. Ordinary women who are anything but ordinary, who are making a decisive difference in terms of their quality of insertion and commitment to the most vulnerable people in society today. And it's in honor of them and in recognition of them that I want to share with you this evening's talk. They have touched my life in a way that I can never articulate adequately. So the subject of this evening's talk is the Church in South Africa at a time of HIV/AIDS. And I hope that I'm going to manage this high-tech technology this evening in a way which will enable us to follow this. Can you all hear me adequately? Okay. So the statistics actually numb the mind. Some 5.3 million infected with the virus in South Africa alone. 5.3 million people out of a total population of some 44 million. 600 deaths at least every day from AIDS-related diseases. The appalling reality of now estimated 1 million AIDS orphans in South Africa, and it's projected that this will reach the number of 2 million by the year 2010. Child-headed households becoming increasingly the norm. And can you just imagine this? A 13-year-old girl caring for 3 of her siblings because her entire immediate family and entire extended family have died from AIDS-related diseases. What is her future? What is her future except how to survive? Her schooling is finished, and what is going to happen as she tries to survive? So South Africa truly in a situation of being one of the 6 worst affected countries in the world at the moment, at present, in terms of the infection rate in sub-Saharan Africa. The others being Botswana, Lesotho, Swaziland, Zimbabwe, and Namibia. But as I say, statistics can never really paint the real human tragedy and the picture of what this pandemic is doing to the precious human beings who are infected with and affected by this virus. In Botswana and Swaziland, for example, 2 small countries with a population of about 1.5 million, the infection rate is now touching around 39% of the population. So what we are facing here is the issue of the very survival of nations, of whole nations. And the increasing infection rate is touching every aspect of life, including the possibility of devastating the economies of the region. So in an attempt to transcend the awful picture of statistics and enter into the human story of the AIDS pandemic, I am going to now show you, I hope, a short clip from a television documentary which was produced by one of the foremost investigative journalist television teams in South Africa last year. They produce a weekly documentary on issues of current importance and interest to the people, and they came out to the diocese to film part of my journey in terms of the HIV/AIDS pandemic as part of a 3-theme documentary which touched on issues of women's ordination in the Catholic Church, the requirement of celibacy as a requirement for priesthood, and the use of condoms as a preventive measure in responding to the HIV/AIDS pandemic. And the sub-theme of this clip was, is anybody really listening to the Catholic Church leadership, of course, in terms of those 3 issues? So to illustrate the question of the use of condoms in the HIV/AIDS pandemic, they came out to the diocese where I work to film something of the ministry in which I'm engaged with these heroic women in one of the huge squatter camps around the platinum mines. The 2nd richest platinum mines area in the whole world is to be found around the town of Rustenburg, near where I live, in which it is conservatively estimated over 150,000 people live in the most abject squalor and misery in squatter settlements. And it's there that the HIV/AIDS pandemic brings to the fore the tragic human face. And I ask you to simply look at this clip, because it tells 3 very human stories which I want to share with you.
Hello, you with Special Assignment. I'm Annalisa Burgess. Thank you for being with us again. This year, Catholics worldwide celebrate the 25th anniversary of the leadership of Pope John Paul II. On the one hand, he's been praised for taking a firm stance on global issues like justice and peace. But on the other, progressive Catholics say he's responsible for keeping the Church in the past, especially with his stance on sex. Tonight's Special Assignment takes a look at the Catholic Church's sexual morality, where priests may not have sex, women may not become priests, and sex may not take place outside of marriage. All forms of birth control are banned, including condoms, a dangerous position in the time of AIDS. This report by Khadija Magadi.
The face of South Africa, the gold mines of wealth and the squatter camps of poverty, home to the desperate, a breeding ground for HIV/AIDS. This is the congregation of Kevin Dowling, a bishop of the Catholic Church. Every day he ministers to the poor and the destitute. Some are forced to sell sex in order to survive. Many of the people here are now dying of AIDS. Kevin Dowling's church says he should not tell these people they can protect themselves, because it is morally wrong.
What I fear most is that thinking people and people who just experience this reality say, but how can that be? You know, is that all you've got to say? You're just irrelevant. And that's what I fear most. Irrelevance, you haven't got something meaningful to say, we're not going to listen.
There's no clear proof that people who believe in the use of condoms have succeeded any better than the Catholics in controlling the spread of HIV. There's no proof of that.
Experts, real experts, would disagree. UNAIDS says unprotected sex is the primary means of passing on HIV in sub-Saharan Africa. And then there are experts who have no medical degrees but know what they see every day, like Kevin Dowling.
Hi, Eunice.
Hi, hello.
Big eye.
It's nice to meet you.
How is it?
Fine.
Is it fine?
Yes.
This is one of the clinics provided by Kevin Dowling's church for the community of Freedom Park near Rustenburg. But Dowling knows one reality. Caring for people when they are already sick means little if you cannot help stopping them get sick in the first place.
Yes. Sophie Masilo.
And if I cannot in some way speak a word of hope to this person which enables them to realize I have an option to protect my life and to be able to continue to care for my little ones. Okay. And it's not an ideal situation. And to simply present ideals to people in this kind of reality, to me, is meaningless. I at least believe we need to interrogate and seriously discuss the issue of protection of life, of saving some lives through the use of condoms, not as a contraceptive, but to prevent the transmission of a death-dealing virus. That's the issue.
I suppose they do say it's unrealistic, but the whole attitude of the Catholic Church to sexual relations is they should take place only in marriage. And we teach that all the time, and through our schools and youth gatherings and so on, promote the idea that abstention is the way of God, and abstention is the safest measure.
What if we as church to say to so many of the women that I've met in places like this, in shacks, who have contracted HIV and are probably in full-blown AIDS very quickly because of malnutrition and so forth, and the poverty and misery. What have we to say to a woman like that? I believe that her life is infinitely precious because that life has been created by God. I believe she as a person is infinitely precious to God. I believe her life needs to be protected and saved. And when she's faced with this unimaginable misery and no options at all, I believe that interrogates us as church in terms of what do we say and what do we do for people like this? Do we say to them that the only options you have in your life are to abstain from sex before marriage and be faithful to a single partner in a stable marriage relationship, because that is the only way that you can protect yourself from possible HIV infection. Now, if I, as a church leader, say that's the ideal, that's what you need to do to prevent yourself becoming infected with the HIV virus. I find that to be at least questionable, if not entirely irrelevant.
The Catholic Church is not a South African church only. It's part of a universal church, and there are a whole lot of universal moral principles that the church teaches universally. And so in a sense, for us to change the rules arbitrarily in South Africa to meet the needs of a particular circumstance is basically impossible for us to do.
Why? What would Rome know about the AIDS pandemic? What would they know, really know?
Well, the Roman Catholic Church is one of the largest providers of healthcare and aid support in the world.
I've argued with some priests who say that it's not fair to slam the church because the Catholic Church in South Africa is doing so much. But they're setting up homes and they've got a lot of centers caring for them who are dying, but they're still not addressing the prevention of further dying. It hasn't stopped, it's going on and on and on.
KwaZulu-Natal is the province with the highest rate of HIV infection in the country, a province whose cemeteries are slowly filling up with those who died of AIDS. The Catholic Church, as in many other places, has clinics and hospitals here.
The healthcare professionals at St Mary's Hospital advise patients about the gamut, the whole set of options that are available to patients to deal with HIV/AIDS, from antiretrovirals to behavior changes, to lifestyle changes, and to condom usage. We are not prescriptive in terms of, we give people the whole scenario and the whole set of options. It's up to a particular individual and a patient to decide which option they're going to use. But within the context of St Mary's, they're not going to have access to condoms as such. Because this hospital is a Catholic institution, it is owned by a Catholic order of nuns called the Missionary Sisters of the Precious Blood, and we function within the Catholic ethos and within the values that are espoused by the Catholic Church.
So in a sense, I think what the church is doing is trying to keep the moral high ground and say, no, condoms is not the solution. Behavior change is the main thing to actually address the AIDS issue.
And I'm afraid, as regards our efforts and the efforts of other churches and all other bodies involved who believe there must be a change of behavior, not very much has been achieved. I think we've all failed on that.
I mean, I don't think I'm giving away any secrets to say that on a pastoral level, many priests are dealing with this problem every day, and they recognize that sometimes it's the lesser evil, and sometimes you have to use condoms.
Raising hopes by making promises not grounded in reality. The people of Freedom Park know a lot about this, and they, like many others, are certainly not listening to the Catholic Church.
Every day of their lives, the hopelessness, the pain at watching someone die in misery on the ground. On the ground. God does not want someone to die like this, and God does not want someone to live like this. That is my position. If God does not want someone to live like this, then we are entrusted by the God of life to make that happen. And we've got to put in place the policies and the outreach and the caring and the programs, and above all a theology and a theologizing in the context which gives real answers to people, which opens doors to people and doesn't shut doors on their struggles.
Bishop, this is Bongani Charlie, and he was born in 1995. Yes, she's got 8 years now. So she's very, very, very sick.
I question that thinking. It's not using an evil means for a good end. It's trying to grapple with a very complex reality and find what may be the best we can do in the situation to protect life. That clip portrays the many issues involved in the HIV/AIDS pandemic. But I want to bring us back to the concrete human reality. And that is that the AIDS pandemic is to be told through human stories, and the stories in Rustenburg Diocese which you saw in that clip. Right at the beginning of that clip, as I walked into that shack, I was with, if you remember, Eunice, the home care worker whom I met when I got out of my car. Eunice is one of the home care team there, 13 of them in that shack settlement, a highly trained nursing assistant and counselor, certificated for this. She is HIV positive. The challenge for us is, what is her future? She's fearful. How can we keep her alive so that her life-giving ministry can not only continue but become even more fruitful? And then, if you remember right at the beginning, we entered that shack and that old man, Francisco, a man from Mozambique, with no family, entirely alone, who was dying of full-blown AIDS. In that shack, another of the home care workers, Margaret, was cooking some rice for him. She cares for him every day, washes him, washes down the shack, ministers to him. On the 21st of February, a Saturday this year, Francisco died. They found him on the ground in the morning when they came to visit him. And worse still, 2 days later, on the Monday, his body was still lying on the ground in his shack because the police had not come to remove the body, take it to the government mortuary for a pauper's funeral. And then that little boy at the end of the clip who was holding my finger, little Bongani, he's an 8-year-old. His mother, single mother, arrived from the Eastern Cape 600 miles away with a baby boy and Bongani. The baby boy and the mother were dying of AIDS. And one morning came to that clinic, the mother with the little child, to meet the sister, the religious sister who runs the clinic, Sister Georgina. And as she held the little boy, he died in her arms. And the mother broke down, became hysterical, and rapidly deteriorated and died, leaving Bongani all alone to be cared for by people like Eunice. A rule of thumb we follow in that shack settlement is that any little one who reaches the age of 3 is more than likely to be negative, because with that poverty and misery and malnourishment and disease and opportunistic diseases rife in a place like that, our little ones don't reach the age of 3 if they are positive. Bongani's 8. He is positive, and he is a little boy with the saddest face that I've ever seen. He never smiles. And from talking to the home care nurses who have looked after him, it seems that he is a victim of another tragedy which happens so often in our areas, a victim of rape. And that it was through rape that he became infected. He is dying, but he can be saved if we can introduce a regimen of antiretroviral treatment for him. But our ethical dilemma is, do we go back to his home area, try to search for his extended family so that he can be brought back to some kind of community setting, but where he will have no antiretrovirals? Do we keep him with us and try to save his life through antiretroviral treatment, which we are about to roll out? So we come to the systemic and the structural issues, the human and the community issues, which are at the very heart of this pandemic. There is Eunice on the right with one of her AIDS patients, very, very ill. A vibrant, caring, compassionate woman. And there is little Bongani on the left. That's the face you see, never a smile. Those are the human stories. I can't show you Francisco because he is dead. In the face of this tremendous reality, what has been the response? Firstly, we move to the South African government. The Durban AIDS Conference in the year 2000 was expected to galvanize our South African government into a very clear and coherent policy direction which they would implement with political will. However, what has come out of our South African government is a whole range of mixed messages. Also, a failure to communicate properly and coherently with the population, unlike the Ugandan political leadership, which for years, from the president down, with all the line function departments, has projected a very coherent, strong message to the population about AIDS, giving them correct information and instilling into the population the awareness of the options they have to protect and sustain life. That has not happened in South Africa. You've all heard possibly of the confusion that has been created from the pronouncements made by President Thabo Mbeki and his National Health Minister, Dr. Manto Tshabalala Msimang. Something that we involved in the AIDS struggle find it so difficult to understand. Pronouncements which have created deep confusion, anger and mistrust in the population, and have not therefore galvanized the nation as a whole and its various sectors into a coherent policy strategy and implementation with political will. The Treatment Action Campaign, which is a coalition of community-based AIDS activist organizations in which we as the church sit as a member of the executive, have represented civil society in lobbying and advocacy to move this government in South Africa towards taking action. And with a coalition of doctors, it was this treatment action campaign that brought the South African government to the Constitutional Court to force the government to treat the issue of antiretroviral therapy as a human right based in our Constitution, to force the government to agree eventually to the rollout of an antiretroviral treatment strategy, which the Cabinet only finally agreed to in November last year, 2003, but which has had a stop-start history since then as one problem after another surfaces, all kinds of excuses being given and so forth. So that even 2 weeks ago, the Treatment Action Campaign threatened once again to take the health minister to court to force her to implement a provision in the law which would allow the government to purchase interim supplies of antiretroviral drugs, to extend these to the sites which have been chosen while the tender process for the large-scale rollout of the drugs was finalized. This kind of thing which is going on. And just last Thursday, the 25th of March, the Human Sciences Research Council, a prestigious research and analysis group, published its findings that in the South African public health sector, hospitals, over 50% of the beds are now occupied by people with AIDS-related diseases. Now you can imagine what this means. The tragedy this holds, particularly for the poor and the vulnerable of society, who need to occupy hospital beds for other treatment, for other operations, and yet over 50% of our beds, and that will rise, are occupied by people with AIDS-related diseases. The implications for the public health sector are enormous in this reality. That is the reality at the level of the government. What has been the response of the church, which is the subject of the talk that I'm giving this evening? The Durban AIDS Conference, to go back to the year 2000, what did that do? That challenged us in terms of the huge caring network and programs and projects which were already being rolled out to focus on clear strategies based on scientific analysis and structuring of treatment as a critical factor which had to be part also of the Church's response to this pandemic. So from the Durban AIDS Conference, in addition to the focus on home care, hospice ministry, caring for AIDS orphans, education programs, behavior formation programs, and so forth among the youth, we now began to strategize around, could the Church's healthcare section in terms of its clinics and hospitals also involve itself in the provision of antiretroviral treatment, which is a highly complex and a very difficult strategy and program to manage constructively and in a way which will not cause damage. 5 years ago, the Catholic Bishops' Conference in South Africa set up the National HIV/AIDS Office under Sister Alison Munro, and I was privileged to be part of that. I came here to the United States, and we had a celebration of a partnership which had been negotiated between the Catholic Medical Mission Board based in New York and the pharmaceutical giant Bristol Myers Squibb. The objective that through the funding over a 5-year period, the Church community-based sector would be empowered in terms of its personnel and funding for well-managed and accountable programs, that this would be empowered by the funding partnership provided by CMMB and Bristol Myers Squibb. Bristol Myers Squibb were focusing on the major projects, very big funding projects, CMMB particularly on capacitating the smaller projects at the level of dioceses. That started 5 years ago. This is the 5th year we're into this now, the end of this Choose to Care program, as it was called. And this was managed from the National HIV/AIDS Office in 5 of the worst affected countries in sub-Saharan Africa. As I said, South Africa with the highest number of those infected, Swaziland and Botswana with the highest infection rate in terms of percentage of the population, then also Namibia and Lesotho, where the infection rate is rising. So from this office in Pretoria, with the project officers, we managed, accompanied, and held accountable through reporting huge programs numbering some 130 major programs across the board in these 5 countries. What are these programs? Firstly, the major aspect of all the Church's response has always been focused on home care, nursing, and counseling. Home-based care and counseling to those who are sick and infected with the HIV virus, and then palliative care for the dying, those who are dying in their homes. What happens, for example, in a diocese like us, we take people through an interview process from the communities on which community representatives sit. They go through a process of selection, then a 5-month intensive training course both in nursing and counseling, after which they are certificated and then sent to minister in their communities. However, what makes home care nursing and counseling, as this is operated here in the United States, different from that in South Africa is that we have to take account of many additional factors in the South African context, cultural realities around patriarchy and the position of women in such a society, the lack of options that women in particular have in the rural settings and in the settings like the squatter camp you saw there in Freedom Park, where single mothers and women from outside the country end up in a desperate search for a way out of poverty, and because they are illegal, they cannot access any social grants from the government at all, because they do not have identity documents, therefore have no options in life, and therefore find a way out of their desperation and poverty through forced prostitution. Issues of gender, issues of stigma and discrimination, where people who've gone public with their HIV status have actually been killed. Slowly, the fear and all the myths and all the total misinformation around this terrible disease are slowly being dispelled precisely by these wonderful people like Eunice and others who are working tirelessly in the communities to bring people to the awareness that this is a sickness like any other sickness, and we care for our people who are sick. Then the socio-political realities, the economic issues which keep people impoverished and so on. All these factors, which I could expound on at great length, make home care nursing and counseling take on a very particular framework in terms of what is to be done, the way it is to be done in context like you saw on that clip. We have in the South African situation the demographics of rural villages with the very traditional way of life under chiefs and tribal councils, and then these huge informal urban settlements where anything goes and where the bottom line is how to survive. And the mass migration from the rural areas to these urban squatter settlements in a way to find a way out of the lack of employment and the lack of hope in the rural settings. And then, as I said, the illegal economic refugees from the north and migrants from other areas of South Africa. And that is how they end up in their millions. At least 7 to 8 million of our people are living in conditions like that in a so-called fairly well-developed country, South Africa. So the basic approach in the programs, and this goes not only in terms of home care and the counseling ministry, which I've reflected on briefly, but in all the programs we roll out, the basic approach has to be a sensitive journey with the people and the communities and the leadership. Nothing can be done at all unless firstly time is taken to develop a relationship with communities and leaders. That Freedom Park settlement has been in existence since 1986. We went in there as church, the only structure organization that ever went into that place, after a faction fight left over 30 men killed on one night. And it was over a process of several weeks that the religious sister and religious brother, in dialogue with this community, slowly gained their confidence and slowly enabled them to start articulating their needs, setting their own priorities, identifying what was an absolute need to be done immediately, and then to start discussing what kind of partnership would they like to develop with the church. That requires very sensitive and caring work to deepen and set up firstly a relationship with the community and its leaders. Then the empowerment of communities to take ownership of their priorities and their community development projects. In other words, that this is not the church coming in to do something for you. This is the church as the community of God's people whom you are, coming to share whatever skills we have, but firstly to listen to you and to deepen and sustain a relationship and a community dimension with you so that we can listen to you and then respond together in a creative partnership. The partnership, therefore, between a listening church, its personnel and community structures, in view of enabling, empowering the gifts that are present in that community, with all its limitations and problems. But there are gifts there because there are people like Eunice. And all she's waiting for is to be enabled. All she's waiting for is to be given the skills through partnerships. working also with the traditional healers, the traditional doctors and other groups in the community. No one has to be excluded. All this takes a lot of time, effort, and careful negotiation and dialogue. Then the formation, once we have the partnership established, the formation and training in value-based responses to the holistic needs of the people. That is where a church partnership with the community takes on a particular role and significance. That we bring our faith-based value system, instilling into people an ethos, the way we care for people, the way we respond to people, the non-judgmental attitudes, listening to their stories without the hint of a judgment, still less condemnation, taking people where they are, walking with them no matter what this will cost us, walking with them so that they can find life, and life to the full, as Jesus asks us to achieve. And then the spiritual dimension, holistic healing, that we look at all the needs, not only the physical, the community, the family needs of the people, but also their spirit needs, that spiritual dimension of their lives. That is a critical dimension which we as church can bring to the whole discussion. And Freedom Park Clinic, which you saw there, that squatter camp, from its humble beginnings 6 years ago, we now have there 3 professional nurses, 13 support staff. Our 2003 statistics, accurate statistics, show that at the antenatal clinic operated at that clinic, 49% of pregnant mothers tested HIV positive last year. Now that is horrendous when you think of the effect of that statistic. 2 to 3% rise in that statistic every single year since we started taking these accurate statistics. We have combined in that whole operation professionalism with care, love, and compassion. And the results are there to see. The poorest of the poor will go to enormous trouble to reach that clinic because, as they simply say, here we will be treated with kindness and respect. Here we will receive all we need. And this is what this religious sister has instilled into her whole team. It's the most beautiful experience. As you saw in that brief clip, people really feel loved, reverenced, and cared for. The management of infections, TB testing, all the kind of infections that develop and so forth. This is a very integral part of the response that we're trying to make in view of the terrible AIDS statistics. And then, because we have to be holistic, and because we have to give women in particular options and the ability to say no in terms of sexual relationship and not to be forced into what they don't want, we have to provide alternatives. So we've developed a community development program with skills training in view of job creation, a food program, and so forth there, with funding partners to enable that community to rise out of its misery. And then we cooperate with 80 traditional healers in that shack settlement, where the traditional healers have been trained to recognize the symptoms of HIV, come with their patient to the clinic, sit in with the nurses while the diagnosis is made, hear what the nurses tell them about the treatment that's required, the drugs that they're given, and then combine and work with our staff in terms of that effort to achieve healing. We work with the Mine AIDS coordinator, who is also working with impoverished and disadvantaged women, social workers, and then the teachers in that community. So an attempt to provide a holistic framework in response to the pandemic. That is what we started with there, a converted container in which Sister Georgina started 6 years ago. That was her clinic. And it's ending up now with converted containers because it's an illegal squatter camp. We can put no permanent building. We weld big shipping containers together and then we simply operate there. Education behavior programs, another strong focus in terms of the church's response to the HIV/AIDS program and pandemic. The focus is deliberately on youth and young adults. We do this through two programs which are based on peer ministry. Education for Life, peer ministry, where young people are trained in a process which enables them to take other young people through a process which looks at the choices they are making, whether these are life-giving, their relationships with others, whether those are life-giving, to enable them to make choices around possibly abstinence, and then a Youth Alive support club after the process, much like an AA group, where the young people who've been through it are given the support to continue the options they've made. Then the ABCD University Technical College program developed by our own students, which I have a poster here which you can look at afterwards. It's a holistic approach, not just to abstain, be faithful, condomize. This is abstaining from a whole range of issues which are life-threatening. Be faithful to values which are going to contribute to quality of life. Change your lifestyle, or you could be in danger of destroying the environment, and so on. Those are the kind of programs which are being developed now. However, just 2 weeks ago, we got the first preliminary statistics about the effectiveness of these programs. In the young adult groups, it is found that after the Education for Life program, the respondents show that only 1/3 of those who went through the process are remaining abstinent or abstaining from sex in their sexual relationships. That is, obviously they are abstaining from sex, but in their relationships with each other, this shows 1/3 are remaining faithful to that commitment. Among the university students, 1/3 are remaining faithful to the abstinence, 2/3 are not, and of those 2/3, 1/3 are not using condoms in sexual relationships. What that is showing is that we have to begin these behavior formation programs at a lot younger age, before sexual experimentation starts. And the program in Catholic schools to train teachers and the formation of pastoral teams to deal with this issue from a very early age, even in our primary schools. Then hospice, terminal care, another facet of the Church's response. This is always going to be exceptional, because the main focus will always be on care in the homes for the sick, right to the point of dying in the homes, surrounded by love and care and support. However, so many live and die alone in poverty without any support structure or family, and in those cases, through the home care system, they will be brought to hospice or terminal facilities where the professional nurses and their support staff will provide the caring ministry to the dying until they die. Volunteers from the parishes are invited in to pray, to be present to them, to the person right to the end. And the objective, to enable people who are frightened, lonely, unsupported and unloved to die in peace and in dignity. So from this, Sister Georgina, with a very sick and dying AIDS patient with a drip and so forth in her, in this converted container, to take them to the hospice we are building on the mission where I live. This is where it is being built, an environmental project, and there we have the team, Georgina with 2 of our management team, to run the home care program and the hospice. Orphans and vulnerable children, another facet of the program. Training and support is being given to parishes and groups to change the mentality so that we create a caring environment. Foster care so that we avoid the institutional approach at all, if at all possible. Institutionalizing orphans is not the way to go. Keep children in their communities so that they develop their culture and the support environment of people and their communities and their culture. We supplement that with daycare centers where the children who are simply being housed but cannot be cared for because people are too poor are brought into a daycare center where food and medical care and basic education is given. We link this to the antiretroviral program to keep the children alive, if possible, and terminal care for the dying children, little ones like that. To support this, we have a major program at all the dioceses, which was piloted in our diocese, to enable carers to support those in their care through accessing social grants, identity documents. They go door to door to fill in the documents, take photos, take them to the Home Affairs Department so that people get their ID documents, help people then to access the social grants by showing them where to go, how to do this and so forth, so that people can be empowered through the available government grants to take some kind of ownership of the caring they are doing. And then the database that we develop to reveal to government where the blockages are, where the problems are in the system, and how these can be remedied on the basis of clear information on the ground. And then finally, our antiretroviral project, which is just starting, the initial rollout in 24 clinics and hospitals, church clinics and hospitals like you saw St. Mary's, the treatment objective to save lives, the focus firstly on mother and child programs to keep both alive. Nevirapine at the moment, that single drug is being provided at no cost by the manufacturer, but the treatment regimen involves 3 drugs which we are trying to give to the mothers in a very carefully planned and accompanied way, and now can be provided at $90 per month through action to get the pharmaceuticals to drop this. The criteria, CD4 count below 200 and AIDS-defining illnesses like TB or meningitis. And large companies now are providing the ARVs to staff. At the national level, 600,000 have been estimated to urgently need this therapy right now. 20,000 are receiving it, but they are mostly the people who can afford it, who have medical insurance. The drugs, the prices now dropped to $90 per month. But the government objective is only to get 53,000 going by the 31st of March, and this is not going to happen, which is now today. The 53 projected sites of the government's plan are in all the major regions, but only 2,500 are actually receiving antiretroviral therapy at the moment. And they will only be available, the ARVs, in the public health sector by July this year. So the TAC, the Treatment Action Campaign, is demanding that the government must set up this interim supply, and the Church in its response has over the past year developed its own infrastructure to accompany a well-managed antiretroviral program, so that a person like that, a young mother, can be saved. There she is lying in that clinic of ours, hopelessness etched on her face. The church action is being coordinated so that we work together, the Parliamentary Liaison Office dealing with public policy, the National Catholic AIDS Office, the Justice and Peace Department working on the social grants, the Development and Welfare Agency doing these community development programs, the Rural Development Support Program providing the training for communities, and the objective to increase coordination around advocacy, programming, public policy development, and sustainable programs. I am working with all those groups for the past 3 years so that we can coordinate our strategy, planning, and programs. Caring for the carers is going to become one of the major concerns of our church-based network, because a holistic response to our people suffering in this way requires that the church personnel are growing in wholesomeness. Great stress is involved in this ministry, especially in our inhuman conditions, as you saw. And we need to provide people with holistic programs, not only the counseling that is provided, but also retreat experiences, especially for the home-based care workers and those in hospice and orphanage programs, to develop their spiritual awareness and response to this pandemic. Some issues for the Church now in conclusion. protecting and saving life, as you saw on that clip, the issue of the condoms, the theology concerning survival. We need to construct an ethic and a moral theology around the issue of survival of both individuals, whole communities, and even nations. Developing a theology of evangelization which includes the transformation of the issues affecting life, which diminish life or crush life or destroy life, the systemic issues in society. This is part of the Church's mission to overcome. The theology and spirituality concerning the cultural, gender, stigma, and discrimination context in which we struggle here. And then developing and integrating spirituality for AIDS ministry in the situations of despair which we face. So the future, in conclusion, the bottom line to all this is finance and funding. Partnerships with the developed world and its organizations to enable and empower our people who know what to do, who know what can be done, but don't have the wherewithal. Global solidarity is what it's all about. The World Health Organization has its plan now that 3 million people will be put on ARV treatment by 2005, the 3x5 initiative as it's called. $200 million is needed this year and next year for that. To train 100,000 local people, bring together the skilled people and experts to assist, and the supply chain to enhance the healthcare system's infrastructure. If 3x5 fails, Stephen Lewis of the UN AIDS says there will only be the mass graves of the betrayed. That is what we will be left with. And the challenge for me and the question for me is, in the face of this, can people have life and life to the full, as Jesus wants? And can we look into a picture like that of Eunice and Bongani, and as a church respond to that reality in a way that is life?